Hi, I am Nosil, and welcome to my channel where I share real stories from inside the hospital walls. Today's story is about the evening I finally understood something I had overlooked for years: the deep fear some patients feel before surgery. It was a calm shift, not too busy. A surgery was scheduled for 3 p.m., a routine appendectomy. Usually, appendectomy are not expected to be more than 2 hours on a max. Everything looked normal, everything felt normal. The patient was taken to the theater, the surgery started smoothly, and the appendix was removed within minutes. But just as we were preparing to wrap up, something unexpected happened. The patient began to struggle. At first, we thought that the anesthesia was wearing off, the normal pain reaction when anesthesia is wearing off. But then, within few seconds, he started vomiting. All of us were apprehensive. We started resuscitating, adjusting the couch, give emergency injections, administer oxygen, and before you can say jack, he stopped breathing. We initiated CPR immediately. I was the anesthetics, managing the airway. As we walked, I kept speaking into his ear, calling his name, because I know hearing is often the last sense to go. 30 seconds passed, but it felt like forever. Then, he started breathing again. The surgery ended up lasting over 3 hours. I closed almost 2 hours past my usual time. But the thing that stayed with me wasn't the overtime. It was what the patient said before the surgery, that he was afraid. At the time, I was trying to get him sign the consent form. At that time, I didn't think much of it, but after what happened, I finally understood. Since that incident, I have never dismissed a patient's fear of surgery. To us health professionals, it may be routine, but for them, it's a terrifying unknown. I speak with more empathy now. I stay prepared before and during the surgery. And after that incident, our hospital MD bought us new monitor, which has been very essential in tracking the vital signs during surgery and other critical cases. Sometimes it takes one intense moment to change your entire approach as a nurse. For me, it happened in that operating room. If you're a patient, I know that your fear is valid. And if you're a healthcare worker, listen deeply. If you found it meaningful, please like, subscribe, and stay tuned for more clinical stories. This is Nosil, and these are the stories that shaped me.